Welcome to Hamdard Medico. Today in this very lecture I am going to explain the blood supply of the stomach. In order to understand the blood supply of the stomach, first you need to understand the course of the abdominal aorta. The thoracic aorta, when it descends down the diaphragm, it is then becoming the abdominal aorta. The abdominal aorta is then giving an anterior branch at the level of the first lumbar vertebra, and that very branch is called the celiac trunk. The celiac trunk is then giving off three branches, and these three branches are then supplying the stomach. The very first branch of the celiac trunk is called the left gastric artery. Then we have the splenic artery. And then we have the hepatic artery proper. Now first of all I am going to explain the left gastric artery. The left gastric artery ascends upward and it is supplying the superior portion of the lesser curvature of the stomach, as well as it is supplying the abdominal esophagus. Now the remaining portion of the lesser curvature is supplied by a branch of the hepatic artery proper, that is called the right gastric artery. Now let's talk about the splenic artery. The splenic artery is passing posterior to the body of the stomach. Its part is tertorous. It is wavy in nature, as you can see, and the splenic artery then terminates by entering into the hilum of the spleen. The very first branch that is given up by the splenic artery is the short gastric artery. The short gastric artery is supplying the fundus of the stomach. Then the splenic artery is giving another branch to the greater curvature of the stomach, and this very branch is called the left gastroomental artery, or you might say this as we have the left gastroepiploic artery. This is supplying the superior portion of the greater curvature of the stomach. Now the remaining portion of the greater curvature of the stomach is supplied by an indirect branch of the hepatic artery proper, and this very artery is called the right gastroomental artery or the right gastroepiploic artery, and this is entering a branch of the gastroduodenal artery,